I'm Dr. Sridhar. Welcome to my channel. I hope you're enjoying the videos that have been shared so far. I have a request. Please do subscribe to the channel, as your subscribing motivates me. And please do like and comment on the videos as possible. Continuing with the MCQ series, so this question is related to sampling for a blood gas through a heel prick. So which of these factors are important in heel prick sampling? Using the appropriate size lancet and avoiding the needle, use appropriate site avoiding the central part of the heel, warm the heel adequately, which is also called as arterialization, use a heel warmer preferably, and relax adequately in between the squeeze to permit the filling, and all of the above. So this is not a trick question, this is very easy, and so I'm not going to really pause. You know that the answer is all of the above, but the reason I made this question is just to focus on the most important aspects. So if possible, try to use lancets, because the lancets have an appropriate width and they have the right depth. You have premature size, you have very premature size, and also the term baby size. And if you have blood sugar, they're not even that wide. So you have tiny lancets for the blood sugar alone, and for sampling you have the slightly broader lancets. The depth is regulated 0.7 millimeter, 1 millimeter, 1.2 millimeter. Different companies produce different lengths. But if you are using a needle, the depth you go to is not regulated. It purely depends on the force you are using, which may vary by the user, and also the time according to which you are doing it. So if same person doing it may not replicate the same depth, you have a chance of hitting the bone, risk of osteomyelitis. It's going to be more painful, as well as you are actually forcefully pricking, while the lancet is a spring-loaded function. So try to get lancets. If you don't have locally available, try to source it. Try to get a group practice so that you get cheaper options for getting boxes of lancets and share them. The appropriate site, obviously it's very important to be familiar with the anatomy of the heel, and the middle portion has the nerves and the vessels running, and also the vascularity. The skin is thicker there, so it doesn't bleed very well. So the puncture site is ideally in the medial or lateral sides. You don't go too lateral as well, because the skin becomes thicker there and it pains more. So obviously avoid the central portion and focus on these areas. Warming the heel adequately is also called arterialization. The capillaries dilate, so the blood from the arteries enter directly quicker. The heel warmer, that is using the principle same as the mattresses that we use, isothermic mattresses. So you squeeze the material or break it, and then the heat is generated. It's an endothermic reaction. It's set to the right temperature it will reach, and it doesn't overheat. So when we use warm water in a gauze or something, it can burn sometimes, and it cools quickly, so the effect is not going to be maintained. So if you have the affordability and you have the access, you can use the heel warmer devices preferably. The most important aspect that most people make a mistake in the initial days is holding and squeezing, thinking that they're going to bring more blood. This is going to be disadvantageous in two ways. One is the arterialization is lost, because basically you're squeezing out all the blood in the veins. And the second part, unless you really relax and don't squeeze too tightly, the arterial supply is going to drop. And without the arterial supply, the blood doesn't flow. So remember that you have to relax and not hold too tightly. Just gently squeeze and relax, so that the blood comes consistently. It's very important to teach this point when you're supervising a junior colleague to do this procedure. These are all very important points. I hope this helps, and please do share this and do like this video so it reaches more people. Thank you.